Welcome to the Jonathan Van Bilsen Show, featuring lively, in-depth conversation with compelling guests from our community. And here is our host, Jonathan Van Bilsen.
Hello and welcome to the show. Many people, as they progress through life, find issues with their vision, largely due to cataracts. Today we're going to explore cataract surgery with one of Canada's foremost eye surgeons, Dr. David Lane, who has personally completed over 30,000 surgeries. David, welcome.
Thank you very much for having me.
I find eye surgery is an interesting element of what the healthcare system provides. It's obviously something that everybody is concerned about. Vision loss is something you certainly don't want to even entertain. So before we get into it a little bit, I want to dig back into your past a little bit. Let's find a little bit about David Lane. So are you from the Toronto area originally?
Actually, I was born in South Africa.
Oh.
I lived there for 8 years, and then we emigrated to Canada. My father was a dermatologist, and he got offered a position in Saskatoon, so that's how we ended up there.
That's, yeah, I'd love to go from Cape Town to Saskatoon. I could see that move as being something that...
It was a shock in many ways.
Yeah, I've been to both, and given the choice. But you went to the University of Saskatoon?
The University of Saskatchewan, that's right. I started out in microbiology and quickly learned that that's not where I wanted to spend my time. So actually I switched to French. I did 5 years in French. Right. And then after that I moved to France. I did some postgraduate work in French literature.
Interesting.
And then I came back to Saskatchewan. I did medical school there and then ophthalmology in Toronto.
Wow. So you got French, English, and Afrikaans under your belt. That's, wow, we're a multilingual show now. Why medicine? What prompted you to get into medicine? Because of your dad's background?
Not so much. I really enjoyed French, but I realized that perhaps there weren't that many opportunities for a French teacher in Saskatchewan. And I applied to medical school. I was lucky. I got a position. The nice thing about medicine is there's so many areas you can go into. And I knew I would find something that I was interested in, and I was lucky to find ophthalmology. Ophthalmology is great. It's a very highly specialized microsurgery that very few physicians know a lot about.
Right.
And the great thing about it is that I have the great fortune of being around people who are happy and grateful.
Right.
There really is no better job.
Oh, that's wonderful. That's good to hear, because you do meet a lot of people who are not happy in their work, and so on. Plus, I've been to your office, and you have a lot of neat toys. For lack of a better word, there's some fantastic equipment that's available for eye care. So I understand you were working in Toronto, or you were in the Toronto area, and it was your wife who suggested you move out of town?
This is true. My plan was actually to stay in downtown Toronto. I was planning on doing surgical retina. My wife was not too happy with that. She wanted to raise a family in a smaller place, so
right.
I obediently moved to Lindsay, and the rest is history. But honestly, now that I know what I know, I wouldn't trade it for anything. I think it's a great place to be, and it's close enough to the big city, so if you want something from the big city, you can go and make the most of it. And I did work part-time at Sunnybrook for 10 years.
Right.
I taught residents there for 10 years, and then after 10 years, things were so busy in Lindsay, and the commute honestly was a little bit of a challenge, so I've just been full-time in Lindsay for the last 10 years.
Now you're doing some work with U of T as well? You lecture there part-time?
I do. I give talks regularly at the Toronto Cataract course and at different places, so I'm still affiliated as such.
Okay. And how long have you been in Lindsay?
It's been 20 years. It seems like yesterday, but it's been 20 years.
And it's a good move, obviously. You're happy with it. Your kids have grown up there. And
oh, absolutely.
Yeah,
absolutely. Great place to raise a family.
Yeah. Wonderful. So you were also, I've got here, you were chief of surgery at Ross Memorial Hospital in Lindsay for a few years.
That's true.
Now, how does that work as far as an eye surgeon? Like just...
There are several different surgical specialties involved in the Department of Surgery, and I think it's important that everyone steps up to the plate and does their part for their local hospital. So I decided to accept the position of Chief of Surgery for a few years at the Ross, and yeah, I'm happy that I did that. Really.
It must have been stressful because I watched A Good Doctor, so I know that there's a lot of administration that as part of that job.
There is a lot of administration. The main purpose of the job is quality of care, so you're really responsible for quality of care.
Okay, all right. So you've been doing it for you said over 20 years, which is great. You've got a long list of accomplishments. I went online and I read there's 30 or 40 different. We're not going to go through them all. That would be a show in itself. But I am curious about your martial arts. And I'm a little bit nervous too, so in case I say the wrong thing and you know your foot's going to slip out or something.
This is how I spend a lot of my free time. I've done martial arts all my life. I started Taekwondo when I was 12 years old, and I've done it right through medical school. I used to compete. I don't compete anymore. And I've learned a lot from it. I think in North American culture, a lot of people are looking for immediate satisfaction or immediate gratification.
Right.
That's really the main thing that I've learned from martial arts, so that's really not my approach. My approach is to work hard, live in the moment, and concentrate on the basics. And that's what I've learned from martial arts, and the rest just falls into place. Also, staying fit, I think, is important.
Right.
I do work out with my staff. We have yoga classes at 6 a.m. at the office. We have fitness classes at 6 a.m. We have kickboxing classes at lunch hour.
Really?
And then I work out with my kids on Saturdays. We do kickboxing with them.
I'm glad when I was there. I had my eyes done last year, and I was glad when I was there that I didn't know all that because you know I can get cocky and I didn't want to say the wrong things. We've had a lot of questions about cataracts come in and the surgery, and I wanted to touch on those. I just wanted to explain a little bit about, get you to explain a little bit about your office because I know your waiting room tends to be very, very full at 7:30 in the morning, and then by 11:30 it's empty. So you have a great system that of putting people through that, and maybe you wanted to elaborate on that for a minute.
Sure. That system honestly has changed a lot since COVID.
Of course.
We have the good fortune of being on a main level or main floor, so we've hired a couple of extra staff, and we have the parking lot now. So people are waiting in their cars, drivers are no longer coming in, so somebody will come out and greet people in their cars. We have signs outside to ask people to wait in their cars. We come and greet them there. We bring them inside. If they don't have a facial covering, then we will put a mask on them. And then from that process, I think it's really important to have an electronic medical record system that shows patient status based on where they are in that whole process. Secondly, everybody has to be cross-trained, so every person knows everybody's job or everybody's position. It's not just this is what I do and this is what this person does. So by having that good EMR, you can see from a master screen at a bird's eye view exactly what's going on, who needs to do what time drops went in, what time freezing went in. And so without talking and having to say, Mrs. Smith needs this done, can you please do this? We just take a look, we know it needs to be done, and every person can do anything. And that's how that works. And also I try to have it slightly overstaffed. There's always going to be problems where somebody gets sick or whatever the reason might be. So there has to be that flexibility in the system. But I think those are the main things to make sure
you have a substantial staff. You must have 15, 20 people there?
Yes, so I have 13 on the clinic side and then 15 part-time on the surgery side.
Really? That's quite an operation. The thing that amazed me the most, I think, about the entire process was that it was totally, totally seamless. It was painless, which blew me away because you don't know what to expect, right? You hear everything, oh, your eyes are going to go black, you can't see for a couple of days and so forth. And it was really, the pre-op was amazing. Like it was very, very simple. The surgery was even simpler. And it's great to have them done. I think I had them done 3 or 4 days apart. And it's great to have the first one done. You know what the process is. The second one, it's a breeze. There's absolutely no stress whatsoever. And the end result was, and I'm sure you hear this from everybody, you know, you leave, I went to Tim Hortons for a coffee, and wow, I can see. And it's unbelievable. And people who are aging have no idea how their eyes degenerate over time. Like, and when you bring it back to the way it was when you were young, the vision, it's unbelievable. So a couple of questions people have asked. Cataracts, first of all, what are they?
Sure. I should say I never tire of hearing that. I love hearing that every day. So first of all, cataracts basically just mean that the lens inside the eye, just like a camera, so the lens inside the eye is cloudy. That's what a cataract is. And cataract surgery simply means removing that cloudy lens and replacing it with a clear lens implant.
Okay. And is there any way you can avoid cataracts?
Everybody gets cataracts at
Okay.
some point in life. There are certain things that will probably speed up the process.
Okay.
People who smoke, people who drink excessively,
Really?
people who've been really sick, so if they've had an ICU admission for some reason, the cataracts always progress more rapidly.
Okay.
And then there's genes. So you can't pick who your parents are. Some
Right.
people get them young, some people get them later in life.
Okay, so it's like taxes, right? You'll
You
get
bet.
them. You
You bet.
will eventually get them. And so the symptoms vary, from what I understand, from cloudiness to blurriness to like what sort of symptoms? How will people know that they have a
That's
cataract
very
issue?
true. They do vary a lot. The most common thing that people say is, my vision is blurry, my vision's just not as good as it used to be. I used to be able to see street signs when I'm driving all the way down the street. Now I'm almost on top of them before I can see them. Some people talk about recognizing people, so
Right.
they have difficulty recognizing faces across a room. Those are the most common complaints. Some people do have other complaints that are perhaps a little bit less common. Glare, halos, and that sort of depends on the type of cataract,
Right.
or even double vision within one eye. So
Okay.
double vision usually means that both eyes aren't quite set the same, but if you cover one
Right.
eye and you still see double, that's probably a cataract.
Okay. Yeah, I know in my case, one eye I was very blurry and the other one was fine. But yeah, and it's something that tends to come with age, right? Now, in my case, it was very young. I think I was 30 last year when I had them. But it does tend to come with age, right? The older you get. Now, I know there are various types of surgery, and we'll get into that. But bottom line, is it dollars that drives the process? Like the more money you spend, the better job you get? Is that sort of how it works?
No, that's not true. I think it's very important to say that traditional standard cataract surgery done in the public hospital setting with a standard monofocal implant is excellent care.
Okay.
It's great care. It fixes a medical problem. It helps people see better. And it's excellent. You don't have to pay anything for it. So
Right.
I think
That's a good thing.
I think that's very important.
Yeah.
And we're lucky to be in Canada because we do
Absolutely.
have access to that.
Right.
So I think it's very important to qualify that first. There are options when it comes to cataract surgery. And yes, if you do have more funds available, you have more options available. And
Okay.
these mainly have to do with being less dependent on glasses after cataract surgery.
Okay.
So in people who are in their 20s and 30s, if they want to get rid of glasses, they have LASIK. They have to pay for that out of pocket rather.
Right.
If people have cataracts but they don't want to wear glasses, they can pay for those services out of pocket.
Okay, interesting. So is there a big difference between cataract surgery and just getting your eyes fixed so you can see? Like when you're 30, you have...
Yes, there is a big difference, and there's a little bit of grayness in the middle. I'll get to
Okay.
that. So when I'm referring to LASIK and PRK, or laser vision correction in people in their 20s and 30s, what we're doing is we're sculpting the glasses prescription onto the surface of the eye using an excimer laser.
Okay.
But it's all on the outside of the eye.
Okay, interesting.
Cataract surgery is different because we're taking out the lens from inside the eye and replacing it with an artificial lens.
Okay.
The reason I say there's a little bit of blurriness here is around the age of 50, people can have what's called a clear lens exchange,
Okay.
which means they don't have a cataract, but essentially they're having cataract surgery
Right.
solely for the purpose of getting out of glasses.
Okay. I'm actually gonna ask you to hold for a second because we're gonna explore this a little bit further. We have to take a break, and we'll get into this a little bit more when we come back from our commercial messages.
You bet.
Hello, I'm Jonathan Van Bilsen for Photos and Travel, where we bring the world to your doorstep. Traveling during this pandemic is virtually at a standstill. However, thanks to Rogers TV and YouTube, my new show Photos and Travel is heading into its second season. Join me for a new episode every month when we get together and explore exotic locales around the world. Check local listings for dates and times, or visit Jonathan Van Bilsen's Photos and Travel on YouTube. Welcome back. Dr. David Lane, one of Canada's foremost eye surgeons, is with us today. We're talking about cataracts, we're talking about replacement of lenses, about basically giving you an opportunity to see as well as possible, no matter what stage of life you're at. I wanted to touch on the type of lenses. We'd left it on that just before the break. I noticed there was a note I read about someone who met with you and was really impressed that you didn't try to upsell them to the ultimate in lenses. So I guess you assess someone and find out what their true. Is it true that there are basically 3 types of lenses available? One that allows you to read, one that gives you a better focus, and one is a standard lens. Is that correct?
Yeah.
Without getting into too much detail.
Correct. There's basically 2 sides to it. There's a technical side and a personal side. So I think it's very important to understand the person. What are their visual requirements? Are they happy with glasses, or would they prefer not to be with glasses? I think it's really important to understand that personal side first. Someone who drives a truck for a living is always looking in distance vision. That's most important to them. Someone who's a computer programmer is up here all day. This distance is more important to them. So it really depends on what they do. Second is the technical side, and there's several things that we look at to determine what might be good options for that particular person. I can get into that if you wish. Before we do that, though, maybe just the three types of classes of implants. So the first one was monofocal implant. And the name is intuitive, monofocal, or one focus point. And basically it's a lens where the whole power of that lens is one power. So it lets you see in one plane of vision, one focus point. The next one is a toric implant, and these implants will correct for something called astigmatism. Astigmatism means that the shape of one's eye is more like a football than a soccer ball. Everybody has some astigmatism. About 70% of people have significant astigmatism, meaning that if you correct it, it gives them sharper distance vision. So those are toric implants. The last group is the presbyopic implants. Presbyopia is a condition which is normal, that comes with time in life. As the lens becomes stiffer, people start to move their reading distance further and further away. So there are a class of implants that can correct for this, so you can see up close without glasses. And then there's combinations of them. So a presbyopic toric implant would correct presbyopia and astigmatism.
Interesting. Okay. All righty. That clears it up. Now, in Ontario, I've heard that there is a long lineup for OHIP coverage for this. There's a long wait. So the process then would be I go to my optometrist. He says, yes, you've got cataracts. You need to go and see Dr. Lane and Lindsay. And that's the next step. And then from there, you decide whether we do it in your facilities or it goes to the hospital. And the hospital would be the OHIP based. Is that correct?
That's correct.
And that's primarily based on a financial perspective?
Yes, so in terms of wait lists, there's a lot of variability throughout Ontario. One can just Google wait list cataract surgery for your community, and you will come to a government site that tracks wait list data, so you can actually easily find out what the wait list is for your local hospital. That's all tracked, and I have to report when somebody was referred to me, when I saw them in the office, and then when I did the surgery. So all of that data is tracked. The wait list on average in Ontario is about 6 to 8 months, but it can go up to 2 years. In a private center, usually it's about 2 to 4 weeks.
I know. I mean, for me, it was, I think I went in, first met you in December, and in February I was finished. So it was great. Now, the success rate of cataract surgery, and I know you don't want to get into, out of the 30,000 that you've done, I'm sure 30,000 have been successful, but is there a big risk?
The risks are small, but they are real. The worst thing that could happen is you could lose vision permanently if there were a complication. Overall, cataract surgery, modern cataract surgery nowadays is a very safe type of surgery. But there are risks, and it really comes down to the individual person and the individual eye. Every eye is different. Some eyes are very routine, so to speak, and very straightforward, and the risks are very low. Other eyes can be tricky based on the anatomy, the type of cataract, the attachments to the cataract, whether they're loose or not, how much the brows stand out, how much far set the eyes are, how much space there is inside the eye. And in eyes like that, you know, the risks may be a little bit higher. The things that we worry about are swelling in the cornea after surgery, which can leave someone with blurry vision, bleeding in the eye, infection in the eye, or swelling in the retina in the area of center vision. These are the most common complications that we're concerned about. But the risk is small but real.
Okay, that's good to know, because I don't know of anybody who's had actual issues with it, and I'm not going to ask if you have or not. So are there websites where people can go to find the answers to a lot of questions about, like, is there a, IhaveCataracts.com sort of a site?
Absolutely. The site that I would recommend is called All About Vision.
Okay.
So if you just Google all about vision, this will come up as the #1 hit on Google.
Okay.
It provides unbiased, non-proprietary information about refractive surgery, cataract surgery, eye disease, all about vision.
Okay. Okay. Now, are there lifestyle factors? You mentioned smoking and drinking and all the things that are bad for us. Are there other things that people can do to prevent just eye deterioration in general?
Sure. The one group of eye diseases that is largely preventable is diabetic eye disease.
Okay.
And I have to say something about this because
Yeah.
the vast majority of diabetics in Ontario are type 2 diabetics,
Right.
the vast majority of which are preventable, and actually the vast majority of which are curable
Right.
by what people choose to eat.
Okay.
Um,
I'm
so
with you.
That can
No-
prevent a large amount of eye disease.
So if somebody's diabetic type 2 and they have eye disease because of it, if they go on a strict diet and look after themselves and exercise and lose their diabetes, does the eye reheal itself? Or is it once it's done for the most part?
Quite often they may need to be on treatment indefinitely,
Okay.
and some damage that's done tends to be permanent. But indeed, the prognosis is definitely better if the diabetes is well controlled. There are studies that definitely show that, without a doubt.
Okay. One of the big, I guess, elements of deterioration these days is macular degeneration, which is a word that's becoming more and more common. Is there something that, first of all, what is it exactly?
Macular degeneration is a degenerative eye disease that comes later on in life that affects the retina or the film of the camera at the back of the eye, and it affects the center vision. So when people look at someone's face, they can't see the face, but they can see everything on the sides. It comes in two main forms, a dry type and a wet type. The dry type tends to be slowly progressive. It does not have any treatment. The wet type is rapidly progressive, so people may just wake up one day and notice in one eye they can't see well, or they have a lot of distortion. For instance, if they look at a door frame, instead of being straight, it's crooked.
Right.
And it's really important because the wet macular degeneration does have an opportunity for treatment.
Okay.
And the quicker it's treated, the better the outcome.
Interesting.
And they can actually see better and maintain that vision with proper treatment. The treatment for that is a monthly injection of medicine.
Okay. My optometrist gave me a little square card. It looks like it's a grid with magnet. I stick it on the side of my fridge, and I look at it every couple of days to make sure the lines are straight. Do you specialize in any specific eye disease, or are you strictly doing replacement lenses now? Or?
I mainly do refractive surgery, so in the younger group I'm doing LASIK and PRK,
Okay.
and then I also do refractive cataract surgery.
Okay, sorry, and refractive surgery is what?
Oh, I'm sorry. Refractive surgery mainly relates to people who would like to not wear glasses.
Okay.
So that would be LASIK and PRK.
Okay, all right. So another big eye disease is glaucoma. How do people know they have that? Or do they?
The most common form of glaucoma, there's many types,
Right.
some you know about,
Right.
but the most common form people don't know. And this is why it's particularly dangerous, and why after the age of 40 you should see an optometrist to be screened for glaucoma. There are no symptoms, and glaucoma is a nerve disease of the back of the eye for which there is no cure. However, there are treatments which can, at very best, at least stabilize things.
Right.
And if you pick it up early, then hopefully you can stabilize it, or at least make it progress more slowly. It's a disease which tends to be associated with a higher pressure, and all of our treatments are aimed at lowering pressure through drops, laser, or surgery.
I know my pressure was up and it dropped through drops and after the treatment. And I just went a couple of weeks ago to have it checked, and it's great. It's perfect. So
Great.
I'm glad of that. And this is where they take the photograph of the eye nowadays, and you see the big orange ball. Very, very impressive what can be done. And I'm also happy that they no longer inject those puffs of air into your eye, because that was my biggest fear. I think I would rather go to a dentist than to have that done.
Understood.
So during COVID, what constitutes an ocular emergency now? Because during COVID times you can't just get anything done when you want it, right?
Yeah, boy, there's lots of shades in gray of that question there. That's a tough one to answer. When the first wave of the pandemic came, a lot of people were so scared they just closed their offices.
Right.
Many people did remain open for ocular emergencies. I did remain open.
Okay.
I was there about 2 days a week, and our phone lines were always open. People who had macular degeneration needing regular injections would permanently lose vision without those injections, so I did those. People who would present to the emergency department with sudden loss of vision or sudden onset of pain, those would be ocular emergencies or trauma. So, you know, someone's working with a screwdriver, they slip, they get it in the eye.
Right.
So all of those types of emergencies were still dealt with.
Okay.
Those are sort of clear ones. Where it gets a little murky then is when you get, you know, those symptoms a little bit shaded down.
Right.
And a lot of people did visits by call or by video chat, but honestly it's very difficult with ophthalmology at least, which is a highly specialized area, to truly know what's going on without seeing somebody.
Yeah, it makes sense. And you did stay open, you're still open now, you're back into sort of a semi-normal.
Correct. We're back to the new normal.
New normal,
we are doing surgery again. We're just using the parking lot a lot more. Lots of new processes for cleaning and so forth.
You're doing COVID inoculations too? I did want to touch on, a lot of people have mentioned after they have the surgery, they have to go back in and have a small treatment to correct something. And I had somebody ask me yesterday, as a matter of fact, what exactly is that process?
Sure. So basically the modern way of doing cataract surgery, if you think of the cataract like a grape, we make a circular opening in the skin of the grape at the front, and we take out the inside of the grape, but we leave the skin of the grape behind. It's just a clear bag, transparent, very, very thin, and that provides the space within which the implant will sit. Now, there's always a few cells from the cataract on that bag, which with time will divide and multiply, and they create a haze on that bag. So that's what they're probably referring to. The big word for it is a posterior capsule opacity. So that's fixed with a laser treatment that's easily done in the clinic, very quick. We just put in dilating drops. The laser itself takes about a minute to do. It's painless. And what it does is it makes a little central opening in that bag so there's no more haze there.
Okay, all right, so it's quite common.
Very common.
The one thing I was impressed by, fortunately I didn't have to have that done, but there's no fees once you pay once for everything, and no matter what happens, you look after it. And I like that element, and that's one of the benefits I guess about living in Canada is that, you know, our healthcare is second to none. Although a lot of people would probably disagree with that, but the last thing I wanted to talk about, because we've got about 30 seconds left, is so if I'm concerned about cataracts and that, do I go to my eye doctor, my optometrist, or do I go to my practitioner, my physician?
I would recommend going to your optometrist.
Okay.
Your optometrist has special training with regards to eyes and has the instrumentation that's needed to sort out exactly what's going on. Quite often you may just need new glasses. They can handle that, and they would understand when you need referral to your ophthalmologist.
Excellent. David, thank you very much. Very insightful. Learned a lot. It was a pleasure seeing you. Once again, I'd like to thank you for being here. To you at home, I hope you've learned a lot about eye care and what you can do when you have eye issues. Thank you very much for joining us. We'll see you next time.